That's part of what takes us, 6, 7 hours is to focus on each of these areas and try to get rid of that gel and reestablish a nice jawline. And you can see what the fat injections did. Even though they're not bumpy, they're just nice and smooth in this area. Fat injections here, fat injections up here.
Right.
So I
The
think,
fat in combination with your type of a facelift works really beautifully. And for all of you who are wondering what type of a facelift Dr. Sullivan usually does is a layered plane. It's not a deep plane. It's not a high SMAS. It's a layered plane approach that he uses, which I find very unique and very natural and very sensible too.
well, yes, and I think it does involve the deeper tissues, but the way it lifts it, it targets those specific areas. So we will target these problem regions. Whereas I found I used to use the deep plane. I discarded that 20 years ago. I used the extended SMAS to get some of the things that I want to do to target specific areas. This targeted kind of lift works very well for me because then I can address all the asymmetries that people have from side to side.
Right. Why don't you just do a deep plane? What do you find goes wrong with a deep plane?
For me, I'm able to get a more refined result with something more than the deep plane for me.
Right.
So,
Okay.
again, not trying to
Okay.
be critical of anybody,
Not
but
trying to be critical.
no, I'm
Okay.
not. No.
So tell us about more about the platysmal bands and how do you tack those platysmal bands up?
Yes, great question. So what I try to do is I oftentimes try to go from the side. So the incision would be over here on the side, and I'll try to approach the jowl area, the neck region as much as I can, all of these regions from the side. And I will make, and I'm going to show you some patients later on where I've made the incision underneath because they have fat underneath the platysma muscle. So I plan to show you some MRIs, and without getting too crazy, we've done some studies at Brown of over 100 MRIs, not that I take MRIs on my cosmetic patients, but just we have such a treasure of MRIs here that we study them to find out where this fat really is in relation to the muscle. So I have some examples of that. So what I do after I get the fat out is I suture, as you saw in those diagrams, I'm going to go back to some others, I suture the muscle together from top to bottom in the midline if I need to. Otherwise, I do an approach from the side, and I can still get an incredible amount done on the platysma from the side too.